Indiana is now in the midst of a healthcare crisis, the largest HIV outbreak in state history.
The state health commissioner just declared a public health emergency in Scott County after the HIV outbreak spread to 160 people. But no one is talking about what this epidemic is going to cost.
Tonight, 13 Investigates senior reporter Bob Siegel takes us inside of an epidemic to show us the staggering price tag and why you will be paying for it.
In and around Scott County, the signs of an HIV epidemic are everywhere. Some are obvious, some are not.
And they just wiped me clean.
In Austin, residents like Serena Deaton have been robbed repeatedly. Serena says drug addicts are breaking into homes looking for money to feed their habit. The same drug addicts who've been sharing needles and spreading HIV. The same drug addicts who are supporting a growing prostitution problem in this small rural town. It's why you can now see signs like these on homes and churches all over Austin. It's why the public park is often empty, and why many parents don't let their kids play unattended in their own front yard.
We don't go outside. My neighbors, we used to sit out on our porches all the time, and now we're just like even terrified to sit out on our porches.
The epidemic facing this community has taken a heavy toll, but 13 Investigates has learned the real cost is still ahead. And it's a cost Indiana taxpayers will be paying for decades.
HIV is a very expensive disease process to take care of.
The state's deputy health commissioner says Indiana has already mobilized an incredible amount of resources to investigate every new case of HIV, to provide services to those impacted, and to slow an outbreak that has already infected more than 150 people.
That's expensive. HIV is a life-changing diagnosis.
The diagnosis used to mean a death sentence, with HIV soon turning into full-blown AIDS that killed patients within just a few years. HIV expert Beth Meyerson says that is no longer the case.
Now you could live for many, many years, which is a good news, but it's also meaning you're going to have an expensive piece to that. Hundreds of thousands of dollars a year per person is what we're talking. It's a huge scale for antiretroviral treatments.
Those are just the initial costs of medication to suppress HIV. The long-term costs are much higher, according to the medical director of the Southeast Indiana Regional AIDS Testing Center.
An HIV patient lives on an average of 25 years, so there's about $500,000 of cost related to their health care.
And he says most HIV patients will be forced onto public assistance, which over their lifetime will cost another $500,000.
So you're looking at a cost to the state of, let's say, just under $1 million.
That's $1 million for every patient diagnosed with HIV. Right now, 160 people are newly diagnosed with the disease in Southeast Indiana. Over the long term, that translates into an epidemic that will cost at least $160 million in public funds.
I imagine if we were to ask Scott County in about 5 years, how you doing? I think they will talk about serious economic challenge just in maintaining the health of the population that is now HIV positive.
It's a daunting reality for the people who live in Scott County. Some residents like Serena plan to move away.
I'm actually getting ready to move out of Austin as soon as I can.
Brittany Combs says she's staying put.
And then they put their needles in it and bring it back the next week.
The Scott County Health Department's public health nurse has been working overtime trying to keep the epidemic from spreading. And it's a job with no end in sight.
And this isn't going to be over tomorrow. I will be dealing with this for the rest of my career. I know that.
With the number of HIV cases still rising and a rampant increase in hepatitis C also linked to the injection drug use, healthcare experts say this epidemic could ultimately cost Indiana more than $250 million. Money they say could have been saved if the state had invested earlier in public health care. We have a timeline of the HIV epidemic as it unfolded. You can see that right now at WTHR.com. Back to you.